Do that, I am going to hold and ask them to not resist me. 5, 4, 3. A 2 is the ability to do partial range of motion against gravity. If they can do partial range against gravity, that is a 2. Okay? A 1 will be palpation of what muscle is ankle inversion? Posterior tibialis. Where does posterior tibialis insert into? Everywhere on the bottom of the foot?
Bottom of it.
No, is it posterior tibialis? Yeah, tibialis posterior, yeah. Not everywhere. The navicular tuberosity, correct?
And the cuneiforms.
Navicular
Sustentaculum tali. Metatarsal.
via tendinous vena. Yeah, no, that wouldn't count. You would what the best place to palpate the tibialis posterior is right at its insertion into the navicular tuberosity. Okay? If I'm at the point where I'm trying to find a 1, I'm going to find the navicular tuberosity on the person. I'm going to palpate right over that, even maybe slightly proximal, because I know that the tendon is coming behind the medial malleoli and going into the navicular tuberosity there. And so then I will feel for that contraction and through the tendon there. Okay, and that would be the differentiating 0 and 1. For the peroneal muscles now, we're talking about eversion, so we're going to have them evert their foot. Full range, maximal resistance, 3, 4, 5. Partial range against gravity is a 2. And then for a 1, you can palpate the muscles just posterior to the fibula. Those muscle bellies will be right there. The fibularis brevis inserts into the base of the fifth metatarsal. And where does the longest go? Fibularis longus goes actually underneath and all the way to the base of the first metatarsal on the other side, right? Both of them will help evert the foot. Both the posterior tibialis and the fibularis muscles also assist with plantar flexion. You should know that just in theory, because both muscles are behind the malleoli and coming around this way. So when they contract, there is this minimal effect of ankle plantar flexion. Not nearly as strong as the gastroc, which has the thick tendon further away from the axis of motion. So the gastroc soleus has a much greater mechanical advantage than the fibularis muscles do, or the posterior tibialis, but you should know that those are those actions as well.